Hello, everyone. Welcome to today's webinar, hosted by the American Public Human Services Association, or APHSA, in partnership with Lyssn. Today's webinar topic is motivational interviewing, fidelity in child welfare, real-world strategies to improve outcomes. Next slide, please. My name is Alex Claremont, and I'm the senior content writer here at APHSA. I'd like to take a moment to share with everyone an overview of APHSA and the work we do for and with our partners and members. APHSA is a membership organization that represents state and local human services agencies from across the country through their top-level leadership. We're a bipartisan organization focused on building common ground. Next slide, please. APHSA aims to deliver for our members through three core channels: influencing modern policies and practices with the goal of strengthening communities, building capacity through our conferences, technical expertise, publications, and organizational effectiveness consulting practice, and connecting members with key partners. Next slide, please. Now, speaking of connecting members, I invite each of you to save the date for the 2025 Public Human Services Attorneys Education Conference. The PHSA Education Conference is less than 10 days away. Go to aphsa.org, click on events, and be sure to register today. Join us as we host legal professionals within the human services sector for an event that covers legal trends, policy updates, and best practices in public sector law. Next slide, please. I'd also like to recommend that you visit APHSA's new Career Center. The goal of our Career Center is to connect top talent with amazing opportunities. Recruiters get personalized support and access to a large niche group of human services professionals. Job seekers can discover positions that align with their goals within the sector. Be sure to follow the link on the screen and visit our Career Center page today. Now, before we begin, I'd like to go over some light housekeeping. During the presentation, we request that you put your questions for our presenters in the Q&A panel rather than the typical Zoom chat feature. If possible, panelists will try to answer questions during the presentation, but there should also be time left at the end for questions. Lastly, this webinar is being recorded, and it will be shared with all registrants in the coming days. Next slide, please. Now, it's my pleasure to introduce the moderator for our panel discussion, Carol Hussey, President of Evolve Strategy Group. Carol?
Hi, Alex. Thank you, everyone, for being here today. Good afternoon, morning, wherever you are. I see we have quite a lot of attendees with us today, and we're very excited about that. As Alex mentioned, we're going to be talking today specifically about motivational interviewing fidelity and child welfare, and we're delighted to have someone here with some real-world examples to share those outcomes with you and their experience with you. And I'm delighted to be here in partnership with APHSA and Lyssn, moderating this important discussion. We do know that motivational interviewing, or MI, as we'll probably refer to it somewhat today in some of our conversation, has been arguably one of the most transformative evidence-based approaches in helping families move toward change. But as many of us have experienced, sustaining fidelity in real-world settings is challenging, right? We have workforce issues, we have all kinds of, training challenges and other aspects of supervision and feedback that are challenging to ensure that fidelity to these models. And when we'll talk about what happens when we don't have fidelity a little bit too. So hopefully we can help you today to see that there are some new ways to leverage technology to solve some of those challenges so that you can support your workforce and improve those outcomes for the families who you're working with. But before we dive in today, I'd like to take a moment to introduce you to our speakers. First, we are joined by Maria Vasquez-James, and she is a Social Services Policy Analyst for the Wyoming Department of Family Services. And she's also a member of the Motivational Interviewing Network of Trainers, MINT, which I learned about that as we were preparing for this. So they seem to have quite a good following. If you're not familiar with them, you might want to check those out as well. Maria has firsthand experience implementing motivational interviewing across child welfare teams and ensuring that the Fidelity remains as a living, breathing part of practice. It's not just a compliance checkbox. We don't train once and done, and we're going to hear more about that today. Also joining us is Reyna Puentes, who serves on the board of directors for Mint. She's also a qualitative coder with Lyssn and a training coordinator with the University of Texas, El Paso. So we're going to have a very conversational event for you today. We don't have a bunch of slides to share. And as Alex mentioned earlier, if you have questions or comments that you want to share along the way, feel free to drop them in the Q&A box at the bottom of your screen. We will be monitoring that as we go along and addressing those questions as we can within the context of the conversation. We have allowed some time at the event at the end of our webinar today to also address additional questions that you might have after hearing our conversation. So with that, let's get started. And I am going to start with Reyna and ask Reyna if you could give us a little bit of some grounding information about motivational interviewing and what that really.
Carol freeze for everyone also. Okay, hopefully she'll come back in a few.
Must be having some
Okay, I
bandwidth
think you're back.
issues. There we are. All right. So, Reyna, I'm not sure if you heard my question, but I was hoping you could give us some foundational information before we get started. I'm sure our large audience here, we have people with a wide array of knowledge about motivational interviewing. So if you could just start with a little bit of information about what motivational interviewing is and why it's so important in helping families transition through change.
Yeah, absolutely. I think, like you said, people might be joining us here with a wide array of experience and knowledge in MI, whether you are new to this term and it's your first time, or whether you have lots of training and experience practicing MI. Every time I hear somebody talk about MI, I feel like I learned something new. So hopefully there's something new for everybody today. And the way I like to think about MI, so we can just get all on the same page. In short, motivational interviewing is a strategic way of listening to people and talking with people in a way that really focuses on empowering the person to feel motivated and committed to make positive changes in their lives. And that motivation comes from that person's own reasons, their own personal concerns, goals, and values. And so that is what it makes MI so unique and so special in its way of listening to people, talking with people, and through that, helping people find their motivation for making some changes in either perhaps the way they engage with their families, their parenting, or perhaps their own self-care, or other things in their lives that might help them get closer to their goals of parenting, or their own values around their family.
Thank you for that, Reyna. And I love the way you talked about the empowerment and the agency aspects of that. And it sounds like that's really kind of different for everyone. So could you tell us a little bit about why fidelity to the model is so important?
It really is one of those things that you could attend a training and know the concepts well. You could read a book and say, I know the concepts of MI, but when it comes to practicing it, right, like we know MI typically encourages folks to ask open-ended questions, make affirmations, make reflections and summaries, and use these skills in a strategic way. Fidelity allows us to really know if these skills are being used in the way that research has found that really will help helpers and help their clients actually realize these behavioral outcomes. And so how do we even know that our training is actually being put into practice so that we can actually see those outcomes that we know from many research trials it exists? So that's what Fidelity allows us to do. It allows us to really get a grip on the what we learn in a training and how we can apply it to the real life so that we can actually see those impacts in the families that we work with. And sometimes I say it sounds kind of magical, but really it's true how when you practice MI adherent strategies and skills, you can hear the change talk happening before your very ears. Like you can see it happening in the interaction, which is one of the things that gets me so excited about talking about MI, and which is also what makes it one of the most researched communication strategies that are out there.
That's great. I love, you can sense your passion about it every time we talk. So I really hope the audience sees that today too. Let's talk for a moment, Maria, about your experience in Wyoming. Could you share with us an example or two where MI really shifted the way your team approached a family situation or something that led to a meaningful outcome?
Yeah, absolutely. I think we have been lucky in Wyoming because we have a very long history of using MI as a part of our practice model. But I hear really positive stories from our caseworkers out in the field about being able to make a breakthrough with the family, but they didn't necessarily, they don't believe that they would have been able to do that without the use of MI. A story that comes to mind is a family that we were working with, and they were having a really hard time getting compliance and follow through. And through the use of motivational interviewing, we're able to figure out that the parent couldn't read. And so a lot of the information that was being provided was inaccessible to him, essentially. And so taking the approach of rather saying, hey, be where I want you to be and do what I want you to do when I want you to do it and how I want you to do it, they were able to recognize, like, oh, you can't do that because you don't know what I'm asking of you. And so they were able to have that breakthrough and, give him a safe space to be vulnerable enough to say, I can't read your correspondence.
Mm-hmm.
And I don't usually tell people that I can't read the things you're sending to me. So yeah, we definitely have lots of heartwarming stories like that. We're just taking that moment to look at a person beyond the surface of the problem.
Yeah, it's so important because so much of the work we do is focused on compliance. And so we have a lot of tools and checklists and things like that that don't really factor in a lot of those sort of scenarios where a different approach or different tool can be beneficial that ultimately really does affect those outcomes for folks. So these examples are great for us. Um, it sounds like, I mean, obviously, we want to use these tools to help families and improve outcomes for the people who are being served. But let's also talk about your workers. One of the hardest parts, it sounds like, with an evidence-based tool like this, where it's not black and white, it's not a checkbox or a script, is how do we ensure fidelity to the model without making it feel burdensome to the workers? It's a balance. So, Reyna, from your perspective, why would observation-based feedback be so essential to maintaining quality of service delivery?
It goes back exactly to what Maria just said in this example of this caseworker who probably was doing everything by the book to do their job in terms of offering the resources and asking the open-ended questions and, making the affirmations. And that's where MI goes one step beyond just the techniques and the skills. That's essential to MI for sure. Don't get me wrong. But the other thing that MI and observation-based feedback really hones in on is the relational aspects of motivational interviewing, what the helper, the staff person does through their expressions in their time interacting with that family member to create that safe space so that the family member can bring down any kind of hesitations they may have and ultimately feel safe enough to share first of all, and then to maybe make some changes in the way that they live their day-to-day life. And
Mhm.
so MI started as a person-centered approach, really emphasizing that empathy is key. If you want anyone to make any changes, you gotta start with empathy. And then MI adds the techniques of asking questions that dig for change talk, asking for permission before sharing ideas, checking in with the person after you share some recommendations so that you can catch opportunities like what Maria was just sharing. And that we can really capture through observation-based feedback. It's really hard to know and just to remember what you did in a session, or you could say, well, yeah, I was collaborative. Like, yeah, I created a safe space for the person in our conversation. But observation-based feedback allows us to really identify the explicit statements that were said. And you can see how I get so excited about this, because on the coding side of it, when you're as a supervisor and evaluator of these sessions, you can hear these explicit interactions and they're game changers for the conversation. You can hear the client then open up or share something, just like Maria said, that maybe otherwise wouldn't have been shared, or we wouldn't have gotten there if the MI practitioner hadn't made that explicit MI adherent strategy. So that's the benefit of being able to capture the MI strategies real time and learn from them and grow for them. It helps the learner, the helper, as well as it helps the client.
Mm-hmm. Yeah, no, I can see how that would do that. It sounds to me like as a worker, I would wonder if this is my first exposure to MI, am I going to feel like this is just one more thing I have to do? Maria, how in the real world in Wyoming do you balance that need for fidelity with all of those day-to-day pressures of high caseloads and compliance and workforce turnover and all the things that you're dealing with in your agency?
That is actually a great question and something that we try to address consistently throughout. So one of the really important things that we've learned is it is about clear, realistic, consistent expectations and clear explanation of where we are imagining you'll use MI. So part of that is this isn't, you have to do your monthly face-to-face visits and your case plan and all of your narratives and all of your court reports, and you have to go to court and you have to do all these things, which is what the job is. And so we're not adding something to the bottom of the checklist, oh yeah, use MI. We're saying you have to talk to people anyways, because that's just human conversation. I talk, you talk, I talk, you talk. And so when it's your turn to talk, that you're using MI in your responses. And so we try very hard to set that expectation and understanding of where it will be used. But we also try to reinforce that it is a tool to help you. So if you're going to spend that time, do you want to spend the time in conflict or do you want to spend the time in harmony? And so those very clear upfront expectations and how they are beneficial have really helped combat that idea of like, that's the 101st thing on my list of 100 things I have to do.
Mm-hmm. Yeah, and I could see too how this could be a great tool for really ramping up a worker's depth of the ability to do their job much more quickly. I mean, we talk about turnover and vacancies and caseloads all the time. But I would think this is one of those tools that you can use in the course of doing your job that can, expedite impact and that can, really help a worker to kind of come up to speed much more quickly and to build that trust that's needed with the clients they're working with.
I'll share quickly. I am trained as a licensed professional counselor in the state of Texas. And when I had my first session ever with a client, I was like, what do I do? How do I start this conversation? They talk about creating a safe space. You talk, and yeah, maybe I have a checklist of things to do, but how do I even do this thing? I'm so thankful to know that I had MI in my back pocket. It helps me to explicitly do that in a short amount of time. And that's really what the research has found is when MI is added to a program that is already established and already has good outcomes, those outcomes are enhanced even more. So MI is really not here to override everything that you're doing. Like Maria said, it's something that you're doing anyway. Most people actually, when they go to an MI training, they say, I'm actually already doing some of this stuff. And you're right. It's just that MI has put the research behind it, and it really positively reinforces why we're doing the good stuff that we're doing and why we're holding back on doing some of the stuff that maybe feels so instinctive to do, like such a reflex to want to do it. But going to training and having the MI practice and the observation-based feedback reinforces to me, okay, no, hold back. I'm not going to give that suggestion. I'm not going to try to convince them. Let me instead try practicing MI. So it's a really interesting application of how the helper can really learn to implement the feedback, and that helps their own practice as well.
Yeah. Oh, that's amazing. And I'm sure if you're a person who's starting to use it and then it becomes part of an expectation in your work, that must be validating to know that there's this science-backed approach, that there's proof, evidence that we have here in using this to help others. And it's really refreshing to think about fidelity not as a rigid requirement, but really as a way to kind of preserve the heart of MI and the spirit of partnership and empathy in the work that everyone on this call is doing every day to help others. So that's it gets back to the calling and the work of service. So I think that's really beneficial just in terms of validating your commitments. Um, let's talk a little bit about some of the common pitfalls or lessons learned. We don't want to turn this into a don't do this conversation necessarily, but there's some things that you could share. And I mean, you've both worked with different agencies implementing and monitoring MI. Some folks are using technology like Lyssn to help with that monitoring. What are some of the common pitfalls that you've seen when attempting to introduce MI into an organization, and how others can potentially avoid those pitfalls? Maria, can we start with you on this one?
Yeah, absolutely. I think one of the things that I would say is to have a really clear expectation of what are you looking for. So for example, if I'm going to complete an MI interview in whatever form of fidelity monitoring I'm going to do, what happens if I don't meet that benchmark? Because I think we as people tend to fill in, am I going to get fired? Am I going to get written up? Am I going to be in trouble? Am I less of a person, less of a caseworker, less of whatever because I can't do the thing? And so part of, I think, successful implementation is that that's not going to happen. You're not less than because you didn't have a good question, or because you didn't know how to respond, or because you switched up which side of your double-sided reflection and you ended on sustained talk. What's really going to happen? What's going to happen is you'll get coaching, you'll get support, you'll continue to practice, you'll continue to whatever those things would be, and really just addressing kind of the elephant in the room up front, that it is vulnerable to record yourself or to have someone observe your use of something. And so being, transparent at the beginning, what is going to happen, what's not going to happen. And that has helped, I think, quite a bit in understanding. It doesn't mean that you're less of a person. It just means you had a conversation. It doesn't mean anything at all. That's helpful.
Mm-hmm. Yeah, I like that. We talk about creating a safe space and building trust for clients, but sometimes we forget that the workers need that as well. And so sometimes when we are introducing new concepts or methods or tools into an environment, it's not always about resistance, right? Sometimes it's just understanding or misunderstanding. And what kind of misconceptions, I mean, maybe I'll pivot over to Reyna on this, do you think come up regarding MI or fidelity most often in the work that you do? What do you find in terms of just the implementation within an operation and a program?
Yeah, I think people typically feel like it's going to be a criticism on them and that it's somehow going to negatively affect their job. And really, if as a supervisor you're practicing implementing MI as a supervisor, we know that's not what this is about, right? And so, like Maria said, creating those clear kind of boundaries from the start, even in your supervision standpoint, and letting the staff person know this is a learning opportunity is really important. One thing I've also learned in my own experience is allowing staff people to bring up both a good example that they feel went well and maybe a trickier example that they had some challenges in, so that they have opportunities to get good feedback on and really feel empowered on the good things that they are doing when it goes well. And then also to get feedback on some of the challenging situations, so that at the end of it, it really feels more like they gained more out of it and their fears have been addressed. So that ultimately people end up kind of looking forward to having their MI coaching call or their MI supervision, because it's more rewarding than it is critical. But in order for that to happen, the supervisor really should be implementing MI through supervision. And that's a whole nother conversation, but that's also a really important part of it for this whole thing to work.
Yeah. Yeah, for sure. And I think we should touch on that again in a minute. But I do want to ask Maria too, because one of the things you had mentioned earlier too is setting expectations. And I think the notion of right sizing anything is always important, right? We can all have very big aspirations about any new thing that we're doing and how quickly we want to see outcomes and things like that. Can you touch on any practical ways that leaders might maintain, a commitment to motivational interviewing and establish realistic expectations without overwhelming the staff? Because I could see myself learning something like this and then wanting to really run with it. But sometimes
Yeah,
we have to, go a little slower.
yeah, I think there's a few important parts, some of which is um, small steps building upon it, right? Because I think when you get to the place where perhaps Reyna and I are, and we're enthusiastic and we're excited and we're very driven and motivated by what we know and how effective it is important also to remember that there was a time when we were the person who didn't know anything or the person who was a little nervous. And so an incremental approach is important in whatever we're doing. Also, being really clear with ourselves. What is the problem we're trying to solve? What are we trying to solution for? And what is really the answer to that solution? So are we trying to ensure that MI is used perfectly, exactly according to the practice model 100% of the time? Well, probably not, because I don't think that happens, right? So what are we aiming for? What are we looking for? And how will we measure that? And then looking at a higher level of what are the pros and cons? What happens if someone doesn't have an MI adherent conversation based on the method of fidelity monitoring? And it doesn't have to be that they're in trouble. To Reyna's point about MI and supervision, which is a very different conversation, but what is the response? What will be the feedback? So just having those sort of things taken into account so that when you get to the end user, you can say, this is what we're thinking, this is what the expectations are, this is what will and won't happen, this is why, and here's how we're going to support you and scaffold you to build you up to the place where you can go forth, and always having the mentality of we're all in this boat, all of us are in this boat together.
I love that. Yeah. That's exactly the kind of thing to build that safe practice space, right? And know that it's all working toward good, encouraging and empowering your staff the same way you want to your clients. Reyna, I want to jump back quickly to the importance of observation-based feedback. Not unlike our workers, supervisors also have very limited time and stresses of their own. What does effective feedback look like in practice? And how can technology perhaps maybe make that easier rather than harder?
Well, we certainly don't want to overwhelm the human brain by addressing all the things at once, right? What we know from research is typically picking one learning nugget that the learner can then really focus on and try and practice in their next sessions will allow the learner to feel more empowered and able to achieve that one small step, like Maria was saying, instead of like having a list of things that I need to fix before next time. And so that incremental kind of feedback approach can really help over time. And then also, um, uh, really highlighting strengths as well as highlighting opportunities, giving the learner an opportunity to share first what they find as some areas of strengths or some areas of opportunities, and making the most out of those times that you do have with in supervision by maybe practicing a quick role play demonstration, to kind of get that live practice feedback in the moment, jotting down some notes afterwards of that tricky statement the client said, so that later you can ask your supervisor, hey, can we role play this out so that you can help me think through an MI strategy to practice this? These are some ways that a supervisor in a short amount of time can provide some feedback to the staff person that they're working with, so the staff person can leave with one takeaway that they can then practice in their next sessions.
Mm-hmm. Yeah, that's fantastic. They are very practical advice that you just gave that people can be trying on their own. Very achievable. Don't require big investments, and getting back to setting reasonable expectations. I think that's really aligned with that. Um, in terms of building this culture of learning, not surveillance, monitoring practice can sometimes feel intimidating for the frontline workers. I think Maria touched on a couple of things that she would advise in terms of expectation setting and things like that. What about like at a leadership level, Reyna, in terms of how agency leaders might frame fidelity to monitoring, fidelity monitoring as more of a supportive role and a developmental role? Because even sometimes if your supervisor's like, oh no, it's okay, this is, it's fine. Sometimes it becomes, everybody's very focused on metrics and measures and numbers and things like that. Are there other ways that we can start to create this culture across the agency and at all levels of the agency that encourages, a little bit of vulnerability and a little bit more engagement in maturing your MI practice?
Yeah, and I think it goes back to having what Maria said, expectations on what we're looking for in terms of the MI practice, and letting the people that you're working with know, I'm not expecting you to show fives in the mighty, for example, the motivational interviewing treatment integrity coding system, and fives is like the highest rating in the global you could get that you might expect from like some MI wizards like Bill Miller out there, right? And instead of saying like, I'm looking for these metrics, I need you to have 2 reflections per question. Like that's really hard to achieve. Instead, it's like more practical, like what works for the agency and what works for this learner. Like what would this learner like to practice in their next session? What's going to help this learner feel a little bit more confident when they go into their next conversation with this family member, or into a next conversation that might feel similar to that tricky one that they just encountered, right? So I would start by really asking the learner first, what would you like to learn? What is something that would help you? And if they don't know, then offer 1 or 2 ideas that you might have to then help them gain that skill, look forward to learning more about it in a way that again is to help, framing it in a way that is to help the staff member feel more confident, so that they have options, so that they know what they can do in those tricky moments, because it's going to happen again, probably.
Yeah.
And ultimately, it's to help them feel less burnt out and to help their clients feel more of those positive impacts. And so bringing it back to the research and bringing it back to those outcomes, I think we can all kind of get on the same page of why it might be worth it to spend a little bit of time reflecting on our MI practice.
That's great. Yeah, and we need to know that the leaders and every other part of the organization is invested in this and that they see the value in it. Maria, can you talk a little bit? We've got a few questions coming in. We've already covered a lot of ground today. So I want to move into some of the questions that are being dropped into the chat. And one of them is, does it take varying amounts of time and sessions to build a relationship with the client for them to trust you from the clients who might be more hesitant or resistant to the MI process, because they also have varying degrees of understanding and trust and, motivation. And so can you talk a little bit about, the evidence around that in terms of how long it takes to really make those impacts?
Yeah, I absolutely think it does. And I think there's probably quite a few more factors that contribute to that, such as, do they have a history of involvement with child welfare? Have they had negative experiences? Have they had positive experiences? What was their experience upon the beginning of the intervention? For example, there might be a different way that a situation unfolded if we're talking about someone having protective custody of their children taken in the middle of the night versus someone knocking at their front door during business hours, or some other method of contact initiating that. So there's lots of things that sort of put child welfare workers at a disadvantage going into the conversation test. So I think that it's not just the MI process. I certainly think, though, that the use of MI in seeking partnership and acceptance and compassion and empowerment can really be like a salve, like something to sort of help break down any negative experiences that might be putting the family at odds with the current caseworker, but also all of those situations in the middle of the night during business day, in a courtroom, any place that you're encountering that is an appropriate place to use MI, and can really help set up that relationship to be much stronger and more collaborative throughout the involvement.
Yeah, thank you for that. I mean, that makes complete sense, right? Just like we were talking about our workers who come from varying, places and experiences and all of that. We certainly understand that our clients will as well. Reyna, could you give, you mentioned the coding tools, and somebody already dropped in the chat, clearly they know, they're typing MICA and MITA and all these other codes, that they were developed primarily, at least initially, in clinical settings. So how does that impact how we evaluate the use of MI in child welfare case management? Do these metrics align in a way that promotes case management goals?
That's a great question. And it really speaks to how you're thinking about personalizing the use of MI within your agency. And you're right, they were initially developed for a clinical setting and really not a research setting, more of like a feedback setting. However, they have been used across different settings. Now, the metrics that you're referring to, maybe we're talking about the overall average that's recommended for the global scores. We're looking for scores, that are higher versus lower. Or perhaps we're looking for more overall complex reflections than simple reflections. Perhaps we're looking for more MI adherent behaviors and less MI non-adherent behaviors. In general, those are going to fit for the context of MI in child welfare and case management. However, expecting 2 reflections for every question might not be so attainable, right? And so we still want to look for the same kind of elements across the board, refraining from MI non-adherent behaviors, encouraging more MI adherent behaviors, and also, though, looking out for some of those global kind of ratings, right? How much are the open questions really digging for change talk? Instead of just kind of being random open questions? How much is the practitioner really seeking to soften the sustained talk when it happens, using strategies to soften that? And so in general, those are things we still want to be looking out for. So whether you're looking for that specific number and that matches your agency, or it's more of the practice of it and really hearing how your staff person is applying that technique, I think that's what we can really glean from those evidence-based fidelity treatment measuring systems.
Thank you, Reyna. I have a follow-up question for you. The person asked, who provides observation-based feedback? Is it only the supervisor? And I thought that was an interesting question. One, because I would like to also mention that Lyssn, can be used in conjunction with the supervisor feedback. And that's important because it expands the capacity of the supervisor to do that. But Reyna, if you could talk a bit more about, is it ever relevant that someone else would give that feedback? And if so, who might that be?
Yeah, if your agency would allow for a third-party person that is experienced in coding and evaluating MI, hopefully that has some experience in MI and child welfare, that might remove some of the relationship dynamics from when a supervisor provides the feedback directly to the staff person. It comes from a more neutral party that might be giving that feedback to all staff members, right? So that can kind of maybe neutralize some things, although it might not be accessible to all agencies. So the supervisor is definitely a great person to provide the observational feedback, whether that's through your own direct observation or through using a technology-based system such as Lyssn that can do some evaluation of the MI scale, and then the supervisor can use that information to then have a supervisory conversation with their staff person about their skills and the next steps. So all of the above can work.
Yeah. Another thought I had on that too is, wouldn't it be great? Most states have university partners who do all of that early child welfare training. And wouldn't it be great if they were training on the use of motivational interviewing in their child welfare training program so that folks are more prepared for when they kind of hit the street and go off? They've had that experience and that feedback, like in a simulation lab or something like that. That would be amazing. Okay, Maria, another question in the chat. How can smaller agencies with more limited funding achieve fidelity across all of their staff in using these tools?
I was clicking the wrong button. It's only been 5.5 years, guys, that we've been on Zoom.
Right.
So that's actually a really great question, and I really like that because Wyoming is also a very small agency. We are a big physical place and a small population. And so it is, some interventions are cost restrictive because it costs so much money to pay for anything. I think that one method can be those types of grading tools that Reyna was talking about, such as the Mighty, the MICA, having third parties contract to do those, or having third parties contract for training. We do use Lyssn in Wyoming, and so we do recognize that it is sometimes cost prohibitive, but I would recommend using the tools that you have available to you. Who do you have that is good at MI, that likes MI? How can we support the training and the use of things like MI4, the most current manual that came out a couple years ago? There's so many conversations and examples. There's so many ways to use the resources, and fortunately, Mint is very supportive, and a lot of those resources are free and easily accessible. And as members of Mint, we really pride ourselves on our willingness to share and connect. And so when any state or agency is wanting to reach out to Wyoming, for example, I'm always willing to meet with them.
Yeah, and I would just add that there are a lot of there are certainly Title IV funds available for training and things like that that can be used to support some of these practices and even the technology solutions that align with that. So yeah, thank you, Maria. And I was hoping that you'd have some experience with that we had a number of questions that came into the Q&A regarding funding and sustainability. So we do know that that is an ongoing concern. And I think it's another reason why when you start down a path like this, you want to collect baseline measures for where you're at prior to implementing these sort of programs and solutions. Your ability to sustain funding and commitment to these things is going to be heavily measured or determined based upon the outcomes. And if you can prove the outcomes, right, and you have some data to back that up, that's an amazing thing. So I would always encourage folks to make sure you're thinking about that at the very beginning and not down the road. We have another one here. What are other jurisdictions doing to support workers on a continuous basis, even after Fidelity has been demonstrated using a particular tool? Is there best practice for follow-up engagement after Fidelity has been achieved? Reyna, I'm going to ask you to take that one because it seems to me like, and you can expand on this, is Fidelity a once and done thing? Are you, you get there and then you're like, yay, we did it? Or is there more to it than that?
I think in the perfect world, it would be a once and done thing. But I mean, I'll just tell you personally, I've been practicing MI since 2018 when I graduated from grad school, and I have my days, y'all. So really, MI fidelity is a consistent thing. Even Bill Miller, right, would say that this is something that we're always learning and improving. So even after one, even like as a coder, when I share coding results to someone and say, hey, you're showing MI fidelity, this does not mean that you are a certified MI practitioner, right? This can hold for maybe a little bit, but it doesn't mean that for life you're demonstrating these skills, right? It's like a surgeon, right? When they come out of medical school, they might be really sharp and tip-top shape with their hand maneuvers, but 30 years down the line, can we still say that they're doing the same thing? So with that, we really, MI and the Mint community really recommends what's called learning communities, where your staff, maybe you can set aside 1 hour meeting time for the group to get together and discuss MI practice, role play, real play, review cases together, even review audio tapes together to continue reinforcing that good stuff that the staff is implementing. That's going to reinforce their implementation of good quality MI in the long term, which is what we want. And also, it's going to help anyone who is still learning to group learn, to continue increasing their skills. So learning communities is a really good strategy for anyone who's either new and they're just learning. They can learn from the more seasoned veterans. So there's lots of good benefits that come from a learning community. And that's a really practical way, low cost way. It doesn't really need much other than getting together for 30 minutes, 1 hour to discuss. Maybe provide some snacks, some coffee for the staff. That'll make them happy. And encourage some more of that open space to just chat about MI practice in a consistent, structured way so that it's not left off the calendar, but like you have that one monthly MI coaching meeting, or every 3 months, for example, you have that one standing hour where you have dedicated to practice and discuss MI fidelity.
Mm-hmm. No, that's fantastic. Very achievable, low cost, as you mentioned. And, I think the other thing with that is a lot of state agencies outsource many aspects of child welfare services. And I could see wanting to have consistency in the use of MI, not just with my state or county caseworkers, but also with the provider organization. So I think there's a great opportunity for cross-programmatic collaboration to mature that MI muscle across those various family serving entities as well. Maria, can you tell us a little bit? I know you're in a tough spot there. Hopefully it'll work, but a little bit about your vision for Wyoming for attaining MI, compliant. I won't say compliance is not compliance, but making sure that you're achieving, MI and then sustaining that.
Yes. So we have taken exactly to Reyna's point, like exactly along the lines of Reyna's point. We do have a process where people achieve what we refer to as proficiency. I think that was a name that just sort of carried over. So we use the mighty. People submit recordings until they reach the good threshold on the, the fair threshold on the mighty. We sort of use the analogy of it's like getting your driver's license, right? Like, when you get your driver's license, you go in a car and you show a man with a clipboard that you can drive, and then you drive forever. But does that mean that you're a good driver? well, not necessarily, right? Because we all drive on these roads. And that fidelity monitoring is really the act of doing the driving. And out in the universe, there are other people, and there are police officers, and there's speed cameras, and all these things that observe how well you are driving. And we recognize entirely that there are going to be factors that sometimes you don't drive as well because it's icy, or it's windy, or you got a flat tire, or whatever happens. And so for us, it is really that ongoing component. So our workers have an expectation to submit. We use Lyssn, so we have an expectation that they put 4 recordings into Lyssn a month, because any one time driving with someone is not a reflection of their ability to drive. If you're driving with someone the one day that they get a speeding ticket, you're going to categorize in your mind, that person's not a very good driver, they speed. But if that's the only time in their entire existence they ever get a speeding ticket, it doesn't mean that they always speed. So more is really more. And then what we do with that information and how it supports the process is really how we envision fidelity monitoring. It's being the passenger with someone all the time and recognizing the more global macro patterns of their use of MI rather than those minute details at like a really like day-to-day, moment-to-moment, word-to-word level.
That's fantastic. I certainly can appreciate those conditional aspects that can, have you falter, from one day to the next. Another question, we actually had a couple of people ask this too, is do your staff prefer the AI fidelity monitoring with Lyssn or with supervisors? And I think the question there is it's kind of not one or the other. It's sort of both, but tell us how you use it in Wyoming.
Yeah, I think it's probably both. I think it depends on the person. I think that so our supervisors are supposed to do a little bit of both, right? So everyone puts their recordings into Lyssn, and then they are meant to use the information in Lyssn to provide that supervision and coaching. And so I think some people really, really like the discussion. Some people really just like the metrics, looking at it, moving on with their lives, taking that information. We provide many methods of ongoing practice and support, whether it's through the training modules in Lyssn. We do have that learning community that Reyna was talking about. We have so many practice opportunities available to our staff that people really kind of find the method that works for them, and that's what they do. I think one of the important things about that, though, is that they have to have the option. We have person's training modules. We have our brown bag boosters, what we call them. They happen every 3 weeks, and it's just an open practice. We have refresher trainings that happen on a more regular basis. And so really they came sort of a la carte what they want to. So it's not really that one way or the other is better. I think it depends on the caseworker-supervisor relationship, how well the caseworker and the supervisor each individually know MI and how well they can communicate that to each other. So there's sort of a lot of variety, and having the options is really, I think, what makes the most substantial difference in giving them what they can pick from.
Right. Yeah. Yeah. You definitely give them a lot of different ways in which they can practice and get feedback. And one of the things that, strikes me from the options that you mentioned too, and Reyna, I'd love your input on this, is just this notion of peer support is something that's always huge in child welfare. And I have worked on some projects too, where, you get a couple champions, workers who have found something to be so effective and they are telling all their friends about it. And that is even more powerful sometimes than the training or the feedback or other mechanisms. But yeah, have you seen that, Reyna, in your work where it's this peer-to-peer motivating kind of scenario?
Definitely, it can spread like wildfire, right? When it's a good thing in all the best ways, when someone hears about how they felt such a positive impact in that one case that they were struggling with so much, it makes me want to go and try that strategy or learn more about how to practice that strategy, right? And especially when it's in a safe space with someone who is not judging me, who I feel safe with, sharing my experiences, my vulnerabilities. And so when you have that peer-to-peer environment, that's really great. And also, though, supervisors can create that kind of environment too by using the MI spirit, like Maria was describing, by explicitly demonstrating your partnership, acceptance, compassion, and empowerment. Even from supervisors, that can still be kind of the setting around which we learn and continue to learn MI.
Mm-hmm. No, that's all great. And it makes me think about, just reinforcing the reason why many people get into child welfare to begin with, and, drawing back on that helping people and that motivation and, the impact of that on vacancies and turnover. So this is one more way to support your workforce so that they're achieving the goals that they set out to do in helping people. We're already near the end of our time here today. The time always goes by so quickly when we're doing these webinars, and this has been a really rich conversation today, hugely educational. I know I've learned a lot. I hope that our audience has as well. I want to give a huge thank you to both Reyna and Maria for sharing your wisdom and experience with us today, as well as to APHSA and Lyssn for hosting this dialogue with us. We will be sharing, as Alex mentioned at the beginning of the call, this recording. It should be up by next week. And at that point, you'll have access to all of the information that we shared with you today. If you'd like to learn more about Lyssn and the work that they're doing around the country to support fidelity monitoring of MI and actually other evidence-based practices as well, it's not just MI, but that happens to be what we were talking about today. But with the use of AI and qualitative analysis, so it really helps to expand your capacity and your ability to monitor even more. And so we'd love to share more with you about that if you're interested. Or if you want to connect with any of our speakers that were on the call today, you'll find that information. There'll be a follow-up email that will be sent to you with that information along with the recording information. So please do follow up, share it with some of your colleagues who couldn't attend today. We'd love for them to learn about fidelity monitoring for MI as well. And thank you all for taking time out of your busy days to join us. We appreciate you and all the work that you do to support families every day and strengthen the workforce. And we're delighted to have you. So we hope you all have a great day. Thank you.